Hi, everyone. My name is Lori Flasco, and I help organizations wow their customers and inspire kindness around the world. And as I'm writing my book on kindness, which that means I really do have to write the book and get it published through my accountability, I have been interviewing amazing leaders and people. And today, a special privilege to interview a friend of mine over the years, and I've worked with Fiona Peacefull in so many different ways, and she is one of the kindest leaders that I know. So Fiona is she's the director of people services at Niagara Health systems, and that covers HR, but it also covers volunteers, and she is responsible for 6,000 staff and about 850 volunteers. So she has a really big role to play. And you know, Fiona, you are the kindest, one of the kindest leaders that I know. And kindness, along with being super bright and intelligent and intuitive, along with strategic, collaborative, and she can be tough. And I know that because that's part of what her role is. So with all of that sort of combined, how does intelligence and intuitive and strategic and collaborative, how does all that relate to kindness, and how does kindness work in there for a leader?
So, just my personal focus is that kindness is critical, and that when you can be kind, you can really create a safe space for people to do good work. And I also really value the concept of consistency. And when somebody is used to what they can experience with you, if they know when they're going to come to you with an issue or a problem or an idea, if you do operate from a place of kindness, it allows people to, I think, operate at a different level of creativity. And then that's when you can get results and strategic outcomes. And again, if you take more of a strengths-based kind approach as a leader, you'll allow someone to feel comfortable and safe to be intuitive, to push themselves. And so for me, I've always found kindness it's transformative. It will allow you to really shift how people perceive you as a leader, the trust they'll give you, the way they'll approach ideas. And for me, I appreciate your kind words, and I hope I'm kind. I really do. And I think it's just because I've seen the difference between a kindness culture and an unkind culture.
Mm-hmm. And doesn't it make a huge impact on engagement and productivity and stress levels? But I love what you said as far as being consistent as a leader. They know what to expect from you, which helps when you do have to have some tough conversations, correct?
Absolutely. And it's interesting because we base our next experience based on our previous.
Mm-hmm.
We're staying at a 5-star hotel. I know you've done a lot of work with really elevating customer service, but if you expect a certain standard, you're going to expect that the next time you attend that facility. And I think as a leader, if someone comes to you and has either a very inspiring or a fairly neutral or a negative experience, people will expect that same experience next time. So I think by always operating from a place of kindness, it really can help.
Yeah.
Help create safety.
I think you gave me I'm going to have to go back and listen. I think there's a tweetable moment there, and I didn't write it word for word, but the next time is based on the past or something like that. But it was fabulous, Fiona, but absolutely so true, right? Then people know what to expect.
Mm-hmm.
So I know the NHS has been doing 1,000 acts of kindness, and I'm thinking for, like 3 years. And I was excited to be part of learning from your IT department. They invited me in, they gave me all kinds of information, and then had a chance to do a presentation to your HR department. And that's when it really snowballed, and it rolled out to your whole organization, to the hospitals. How's it going? Tell me about it.
I think it's going well, and because our focus, it's interesting to be part of an organization where there's a real singular focus, which is extraordinary caring every time, every patient. And so the kindness view lens allows you to always focus on the patient. As much as we start with the patient, it's also other loved ones and caregivers and healthcare providers involved in their care. And so as someone who's recently joined the organization, later last year, I was drawn first off the organization because of the values of compassion, optimism, results. And then when I started hearing more about the kindness work, and the best thing is that you see it happen every day. Even this morning there were a few folks outside the building. One person was obviously lost, and they had a bracelet that said memory loss. And so one of my colleagues, rather than just try and ship them somewhere and help somebody else figure it out, she made the call to the number on the bracelet. She got them the care, got them the wheelchair, got them water. But that, to me, that happens in some way every day in this organization. Mm-hmm. Kindness, it's just so ingrained. And I do think partly it's the culture. I think it's also the type of person who's drawn to work. Mm-hmm. So it's going so well. And my colleague, Sandy Trainer, who I know you know, she's just so proud of the progress. And I know we spoke recently, I want to say we're at least 35,000 to 40,000 acts of kindness since your early experience with Niagara Health. And it's across all different teams. When I was first onboarded and did tours of different facilities, you actually see people are so proud to celebrate their kindness. Mm-hmm. And this beautiful visual images of the kind acts to others, to colleagues, to patients, to families, to other volunteers, staff. So I think it's great.
Mm-hmm. And I mean, it must have really strong results, especially if it's become a permanent program that you've been mm-hmm. offering now for 3 years, right? Do you know, Fiona, the impact? I remember hearing Sandy talk about there was a 20% decrease in violence and harassment, which included mm-hmm. things with patients and coworkers, but she talked about engagement. What have you noticed? I know you said being proud, but has there been some real markers that you've seen?
Yeah, absolutely. I mean, Sandy knows these inside and out, but part of our organizational strategic plan is that we measure certain things around workplace violence, and the kindness is seen as a direct correlation to reduced. So we look at patient to staff violence, staff to physician violence, and vice versa. And we've seen a reduction in those numbers, those statistics. And that's been cumulative, that's measured on a quarterly basis. And to me, the other really positive is that we don't go to a team and say, you need to now do 1,000 acts of kindness. These are teams themselves selecting in to do the acts of kindness.
That's so cool. Because they've seen it, right? They've seen the enthusiasm and the difference that it's made in other teams. It's contagious. They want to get involved, isn't it?
Mm-hmm. Oh yeah, and you're not being told, okay, it's Q2, it's now time for, dialysis. No, those teams elect to do it on their own. Mm-hmm. It really excited. And the other thing is, even during COVID, one of the things we saw is teams raising money for local charities that they knew were being particularly compromised from a financial perspective to reduce giving. And so teams just coming together and raising money for food banks and other not-for-profits. Mm-hmm. And that was all employee-led. Mm-hmm. As an organization, we're also quite philanthropic towards the Niagara Health Foundation, along with the United Way. But these were other kind of more unique individual charities that staff really flagged as needing some kindness towards their organization.
Wow, that's great. And you mentioned COVID, and COVID was and still is such a challenging time, and the community loves, the work that you do, and we're so proud of all of the essential workers and know how hard you work to serve our community. But you and I had a conversation about something cool that is, and I don't know, if we can sneak it out, or maybe it comes out next week, but you're going to be doing some things. And can you just share what that is and what you're hoping for?
So you're thinking the kindest rounds?
Yes.
Rounds. So we did launch kindness rounds in January, and we went through all of our facilities just to say thank you. And it was just to say, we want to let you know how much we appreciate what you do. And we also ask people to make a commitment to be kind. What we decided to do this time around, starting this week, is something called thank you rounds. And certainly with all the appropriate levels of consideration for infection prevention and control and personal protective equipment, our executive team and other leaders and HR folks, we're going to be going out to different sites just to say thank you. We know that there's been staff who've been away from their family and their loved ones, worked long hours, beyond, dealt with some really complex COVID cases, along with what we generally see in the hospital. So we're starting that on Thursday this week, where we are going to go to all the sites, and they'll continue next week and into the week after. And the feedback we had from the kindness rounds earlier in the year was really positive, and we felt we could still go out and just have a code.
That's what happens when you work in the hospital.
We have a code yellow. So so we're really excited to be able to go back out and just say, like, I mean, it is remarkable. And the other thing that really was so meaningful was the kindness we saw from the community. And there were times where we would have a greenhouse who would bring their flowers to the employee entrance, and it was just, you know, thank you, our healthcare heroes, and greenhouses bringing in their flowers, and restaurants bringing in food, car dealerships sponsoring lunch for everyone, insurance companies. And it was just, I think we were overwhelmed by that kindness. Know that the groups and individuals and companies doing the recognition loved doing it as well. And we actually, one of our staff, which was pretty neat, she had signs made that said, "Thank you, healthcare heroes." I can't remember how many she had made, but she did it out of her own pocket. And she just put them at locations all through Niagara, some obviously close to the hospital. There's been an awful lot of kindness shown to across the community, and specifically directed towards Niagara Health.
Yeah, makes a big difference, doesn't it, when you have to be working in such tough times. And, you know, can you tell us who's going to be part of those? Because I think that's interesting too, because who's going to be part of the kindness walk around? Because I think, you know, it starts at leadership, doesn't it?
Mm-hmm. Oh, absolutely. And so for us, we have a president, her name's Lynn Guerrero, and Lynn joined us in February. So really, she was on the job for about 2 weeks before pandemic fully hit. And so Lynn will be leading it along with members of our executive team. And we have a very small executive team at Niagara Health. So the team, Flo, Linda, Angela, Lynn, Derek, and Dr. Villian will be leading those executive, or those thank you rounds. And along with, I'll be part of it, and others from across the organization and the HR team. And really, people are just surprised. Like, we don't need anything from anyone. We are just there to say thank you. Mm-hmm. Last time we had all sorts of things that we left. So we have consulted with IPAC about some things we can leave, which we'll be leaving at different nursing stations and other locations. And if you're not there, we'll still leave something for you to get if you're on another shift. So we are trying to work. We go to different locations, different times, so we're not just getting people who happen to work a 7 to 3 or a 9 to 5. So the leadership team, and from what I understand, is our new president has signed up for as many as possible, along with the executive vice president that I work for. Yeah. So I was just so happy to hear that we're seeing real traction to be part of it.
That's amazing. Good for you. Well, congratulations. And I think kind of little drum roll now is you and I have been talking, and I don't know the answer to this, so I'm going to be really curious too. Fiona, who has been the kindest leader? Who's the kindest leader that you know? I want you to tell us, and then tell us why.
Yeah, for me, I thought of many, because I've worked for some pretty kind people who have been tremendous role models. in my opinion, the most kind leader I've ever worked for was the medical officer of health for Niagara, Dr. Robin Williams. And Dr. Williams, I worked with her kind of indirectly for about 15 years. And for me, she was just, I mean, she's an inspiring person, inspiring leader. It's the level of compassion and kindness that she shows. So to me, I hold her up to a whole different level of kindness, and she's tough. I mean, she can be a real tough person. She's so intuitive and clever and visionary, and yet when you really get her in your corner and she listens, it's like nothing you're ever going to experience. She's so invested in your success as a person, professionally, personally, academically, whatever it might be. And so for me, that was probably she's had the most significant imprint on my career. And again, a lot of it came from kindness.
Wow, amazing. And I know Dr. Robin Williams from my daughter, dealing with her years ago, and she has got such an amazing reputation in back then in dealing and caring so much for children and youth, and then heading on into the region in that capacity. So thank you for sharing that. I can't wait to surprise her with that. And and I think that, again, to hear another inspiring story. So Fiona, thank you for your time. And
thank you.
You and I both share the same passion for inspiring kindness around the world. And we both know the importance of, it's not weak and it's not fluffy, and you can be strong and compassionate and strategic and all of those things together. And that's what makes a great leader.
Agreed. And you have been such a kindness champion. I mean, obviously when I arrived at Niagara Health and I heard that you had helped with their kindness, but as well with my previous employers, the last two, is that you were really impactful in shaping so many pieces there. So I think I've been lucky that I've obviously worked for organizations who have valued the work that you do and the leadership that you bring to an organizational or an organization that's committed to kindness. And so I was so happy when I got here, and then I knew that you had done a lot of foundational work as well. So it's just, for me, I couldn't work in an organization that didn't value the concept of kindness.
Thank you so much. You have a wonderful day. Stay safe.
Thank you.